Well, macular degeneration is a painless eye condition that leads to the gradual loss of central vision.
And that's the ability to see what is directly in front of you. It can be genetically inherited, but environmental factors may also contribute. So joining us now with more on age-related macular degeneration is Dr. Matthew Wood with Eye Surgical Associates, and nice to have you here.
Thanks for having me.
We've heard a lot about macular degeneration, just like with our grandparents. I know your grandma had it, and every time we go to the eye doctor, they check for that. So can you tell us a little bit about it?
Well, it's really common. It affects about 15 million people a year in the United States, and it's the most common cause of severe vision loss in those over 65.
But it's good to be checked early.
It is. You know, like many medical conditions, it's good to nip it in the bud if possible or take preventative measures.
So when we talk about age-related macular degeneration, is there really any treatment? Can you actually prevent it from happening?
Well, yes and yes. There are treatments. There are two types of macular degeneration. The most common type we refer to as the dry type. Now, we don't have a good treatment for that, but there's a lot of research going into treatments, even here in Lincoln. The wet type is the kind that we can treat now, and that affects about 10% of individuals with macular degeneration.
Who is more susceptible to getting this?
Well, if you have a family history of it, that does certainly raise your risk of getting it. But there are other risk factors that are modifiable. I mean, you can't change who your parents or grandparents are, or were. But those individuals who smoke have a greatly increased risk of macular degeneration.
So by quitting smoking, you can help decrease it.
Absolutely.
What about just getting back to treatments and preventing of it? I know you mentioned a couple of things. Are these things that you can do in the doctor's office, or are these things do you have to go and have surgery for?
Well, the treatments we do in the doctor's office, typically. The preventative things, well, those are done at home. Those are the sort of things you learn in junior high health class, to eat healthy, exercise, and don't smoke.
Now, are there any kind of vitamins or pills that you can take? I know I've heard my grandma talk about that. She's 90, and she's always checked for it. And I think there is something she's taking for it.
Yeah, the age-related eye disease study was a large study that was done, it was published in about 2002 and involved a few thousand patients. And it showed that those individuals that took a multivitamin that was higher in zinc and beta-carotene, who already had early macular or intermediate macular degeneration, could reduce the risk a little bit by, to getting severe by taking this supplement.
Or keep it where it's at, right? So it doesn't get any worse?
Yeah, yes, I guess you could put it that way, but I think it still progresses a little bit, but maybe puts the brakes on the process. Unfortunately, it doesn't keep people from getting macular degeneration.
Okay, well, good to know.
Yeah, Dr. Matthew Wood with Eye Surgical Associates, thanks for joining us and filling us in a little bit more on this issue. We appreciate that.
Thanks for having me.
Okay.